Hello, welcome back to Ask Angelina, and in today's episode, I'll dive deeper into Taiwan's national health insurance and why the US and other economically developed countries should implement Taiwan's national health insurance. Taiwan treats healthcare as a right, so that's why one of Taiwan's main concerns was to support public health and boost social welfare in Taiwan. Inspired by U.S. health economist Yue Reinhardt, he visited Taiwan and proposed what he wanted to do in the U.S., but he couldn't get it done, so he tried to inspire Taiwan's government to implement the National Health Insurance Program. So what exactly is this program? Taiwan's National Health Insurance Program, also called NHI, is a system started in 1995, where it is a universal healthcare insurance that is partially paid by the government. It specifically utilizes payments from individuals according to their financial and job circumstances. Taiwan's government created the system because one of their main concerns was to have universal healthcare coverage, even for people with no jobs. In order to make this easier, I will break this down into 3 points: cost, accessibility, and choice. First, let's go over cost. How does this health insurance system, like I said before, use payments from individuals according to their financial and job circumstances? Well, employers pay partially for this insurance, but in a private company, employees pay 60% to the government, 10% in premiums, and 30% to their employers. So this means roughly 500 NT a month, which is 15 USD. That is so little compared to health insurance premiums in the US these days. In fact, this insurance even benefits people with no income, the poor, or retirees, because their premiums are mostly paid for by the government. So the other day, I asked my dad how much he pays in premiums for our health insurance for our family of 4, and it's approximately 5,000 USD annually for the 4 of us. According to the latest update in 2024, a typical family of 4 in the US pays roughly 24,000 USD a year. Wow, paying for Taiwan's national health share insurance is far cheaper than in the US and other countries. This is probably why 99% of Taiwanese citizens have national health insurance and why Taiwanese are so proud of their health insurance system. You might be wondering what happens to foreigners who are hurt or don't have this healthcare insurance when they're visiting Taiwan. Well, what's good about this healthcare insurance is that you can pay out of pocket, and for foreigners who have lived in Taiwan for more than 4 months, they can apply for the National Health Insurance Program to get an IC Smart Card, which I'll get into soon. I'll move on to my second point, accessibility. Taiwan uses IC Smart Cards, which are the same size as a normal credit card. In every hospital or clinic, there's a machine where you plug in the smart card, and once your name and number pops up on the screen, you can see the doctor. A doctor can view your entire healthcare history based off your card, and every card is different. After meeting with the doctor, then you can go get your prescriptions and be out the door. Like a few years ago, I twisted my ankle when we were walking down a steep staircase, and we drove to the nearest hospital. When we got there, it was really busy and I was worried that my foot would swell up fast. But I plugged in my insurance card and we only had to wait 3 minutes before I met with the doctor and was casted up. It was super simple. On average, it takes about 10 minutes to plug in your insurance card, get a checkup, and leave. This fast process aligns with this program's high satisfaction rates of 80%. You don't even have to wait long to see the doctor, and it's very easy to schedule appointments and even operations. U.S. hospitals really have to step up their game. For people who don't have an insurance card, all they have to do is fill out an application form with an attached resident certificate and profile picture, and then send it to the NHI. The last point of Taiwan's NHI that I want to cover is choice. When you're part of this program, you can choose any hospital you want to go to, since all government hospitals or private clinics are part of this program. What's great about this national health insurance is that it covers any health issue, from patient annual checkups to buying minor prescription drugs to dental care and even traditional Chinese medicine. It's all covered. Just like how I twisted my ankle, we went to the hospital closest to our location and the healthcare insurance covered it. Even if you don't have a job, there is no stress or worry about losing healthcare insurance because Taiwan believes healthcare is a right. Although there are so many great benefits to this national healthcare insurance program, like cost, accessibility, and choice, like the ones I mentioned, there are still some ongoing issues that needs to be addressed. However, I will get into that in the next episode. Thank you so much for listening. I hope you enjoyed today's episode and stay tuned for the next episode on why is Taiwan's healthcare workforce shrinking?